We're going to be talking about resveratrol and ovarian cancer. So resveratrol, a naturally occurring substance, very supportive to immune system function, energy production. In low doses is used as kind of an antioxidant and just good for overall health. So this is something that you can take on a daily basis in your supplements, and whenever you kind of transition over and you're an actual oncology patient, we actually use resveratrol in IV form and in oral form to kind of bridge the gaps between those IV days to actually help with kind of new targets in the cancer journey for patients. Resveratrol can be given concurrently with most of their current medical oncology treatments. So whether they're currently undergoing chemotherapy, radiation therapy, immunotherapy, targeted therapy, whatever the condition may be, whatever the current therapy may be through their medical oncology team, we can add resveratrol in as an additional support for them. And it actually has research. This is a paper from 2023. This is talking about LNC RNAs and miRNAs, two new targets for resveratrol in ovarian cancer research. So this is looking at those targets. They are a subclass of non-coding RNA. Again, this is getting into the genetics because RNA and DNA, all of that has to do with genetics. With our patients, we also do genetic testing for their specific cancers. We have specific labs that we use that are very good at helping to identify these things. So whenever we find a lot of the genetic targets, there's not a whole lot of medications out there for these genetic targets, but what we have been able to find is that there are a decent amount of botanicals for some of the genetic targets that are known by the labs as variances of unknown significance. So variances of unknown significance is basically saying, you've got these genetic markers, but we don't have a medication in kind of the FDA pharmaceutically approved medication line out there to target them. But botanicals are fantastic because botanicals have a number of targets. They are huge structures, they have lots of components, and whenever we break down those botanicals and actually start studying them, they actually have a lot of targets that we can use. And in this case, we're just talking about oncology, but they also have far-reaching effects in other therapies as well for other indications. But for now, we want to talk about this study of resveratrol in ovarian cancer cell lines. And with this, what it is saying is that whenever we look at these targets, it's actually helping to identify those targets and be therapeutic for many cell lines. This one just happened to look at ovarian cancer, but we use resveratrol for a number of different cancers because it's a potential natural product for RNA, and it can have therapeutic benefit, and we'll, I'm sure, find more uses for it as we go, and as we start testing the genetics of the cancer, getting more information on that, and then also looking at the targets that these botanicals can interact with. And this is an all-natural substance. Most people have no problems with this. They love it. It helps them feel great, and it can be another supportive therapy that they can do in their cancer journey, along with everything that they're currently doing with their medical oncology team. If you'd like to learn more about how we use resveratrol in our practice and for our patients on their cancer journey, please fill out the form below, and we'll be more than happy to talk with you on that.